am Tauseef, consultant in emergency medicine, Aarogya Hastha Hospital, Kasavnil, Bengaluru. So usually an incident happen. Suppose we have a road traffic accident on a road, and a nearby attender or a known informs to the hospital that we have a case, such a case, and the person is affected on her or his lower limb, and there is slight bleeding, and the movement of the limb is affected, the range of movement, and we get information. So we intimate our ambulance services, emergency medicine, and send the ambulance to them. So the do's, we tell them to get a help with a nearby person or a team or a friend or a colleague to keep the person away from the road traffic and allow the patient to be cool and relaxed and wait till the ambulance services arrives. And if there is any active bleeding, we have to stop it by putting compression over it. This is the basic thing we have to apply for any person with a road traffic accident when the person is conscious and oriented. If the person is not conscious, we have to look for A, B, C: airway, breathing, and circulation, whether the person is breathing and having a pulse or not. If the person is not having a pulse and is not able to breathe, we have to assess immediately by keeping the person on a flat, firm surface and check for his central pulse, which is the carotid pulse, which we can feel over the neck or in the groin region. If we feel a pulse and the person is breathing, he may not be very conscious, it's fine. We can wait for the ambulance people to come and do a further basic management and further care. So once the hospital receives a call of such a case, we have to get basic things ready, like first aid kit, the defibrillator kit, along with a doctor if possible, and an emergency nursing team. So we reach the spot and check again for A, B, C: airway, breathing, circulation. And once we ascertain that all these parameters are within limits, we counsel the person and the attendants if they are for further basic management in the hospital. Once we get the patient to the hospital, we check his vital signs, reassure him, and do further care. Like if there is a suspected fracture, we go for X-ray, we check his vitals, and he is able to shift to the X-ray department, we shift him there, or what portable X-rays we can do, we do it bedside in the emergency department itself. These all facilities are more enhanced and easily available if the center is a tertiary care center. Otherwise, if we have a primary center, we do a basic need first aid, like stopping the bleeding, giving a pain relief, either intravenous or peroral, and then transferring the patient to a tertiary care center where he can be further analyzed for any further fracture or any limb disability. Now after we have done a X-ray, we check for any fracture or any other soft tissue injury. Suppose we have a fracture, we try to splint the limb so that the patient is relieved of pain and further joint or the part going into further deterioration of the broken area. And accordingly we inform to the specialty like orthopedics and a physician if any other things like bleeding is there, which needs to be immediately taken care of. So once we are certain that it's a trauma case and the person himself or the bystander is certain about it and a need for further management, we should be intimating the nearest medical center for further workup and help. So with this, it's a duty of every citizen to get to know when there is a trauma, to what to do, what next to follow, and which hospital we can approach which is nearest to us, so that the time is saved. As time is golden here. So with this I conclude my short say on world trauma and wish everyone a good health.